Thank you, Chairman. I'm very honored to be here and to participate in this wonderful meeting. Our authors of this study have nothing to disclose. Technical advancement of robot system provides articulating instrument and stable camera platform and motion scaling and better ergonomics. These advantages might increase the surgeon's performance of comparative TME compared to laparoscopic surgery. Several studies compared the long-term oncology outcomes between robot and laparoscopic surgery. Most of them showed that comparable oncology outcomes between robot and laparoscopic surgery, and a retrospective study from Italy showed favorable local control in robot surgery, and another study showed favorable disease-free survival in robot surgery. Recent randomized control trial showed similar short-term outcomes between robot and laparoscopic surgery, and long-term results are not yet available. Because the long-term impact of robot TME on survival outcome is unclear, so this study aimed to investigate the long-term oncology outcomes of robotic total medullary excision for middle or lower rectal cancer in comparison with laparoscopic surgery using propensity score matching. We retrospectively gathered patient data from our single institution colorectal cancer database from 2009 to 2013. Patients with stage 1 to 3 with oral cancer within 10 centimeters from anaplasy were included. Exclusion criteria are operable cancer and intersphincter resection and AP resection and open surgery and stage 4 disease. Patient with hereditary colorectal cancer and IV-related cancer. This figure shows flow chart of patients included. Covariate for propensity matching score, propensity score matching were patient age, BMI, tumor height, and preoperative chemoradiotherapy and pathology T stages. In the overall patient, people matching, age, sex, tumor height, and preoperative chemoradiotherapy and pathology stage were significantly different between robot and laparoscopic group. After score matching, all variables were well balanced, except operative time. But it is because of the nature of robot system, so it's not included in covariate for matching. Overall follow-up duration was comparable between groups. This is a 5-year disease-free survival rate, and there was no statistical differences. On 5-year distant recurrence rate were about 10%, and there was no difference between groups. And local recurrence was also showed no difference. In the multivariable analysis, preoperative chemotherapy and pathologic end-stage and pathologic T3, T4 disease were independently related with disease-free survivors. When patients were stratified according to the number of risk factor and what kind of risk factor they have, we find statistical differences in the patient with preoperative chemoradiotherapy and T3 disease. Patients who received preoperative chemoradiotherapy and pathologic T3 disease showed a similar disease-free survival and pelvic recurrence, but the standard recurrence rate was significantly lower in the robotic group. So we did a thorough analysis in the whole cohort before propensity score matching. Also, the distant recurrence rate was significantly lower in the robotic group. This study has several limitations. This is a retrospective analysis, and a limited number of patients, and had no information about socioeconomic status of patients, which might impact a patient's treatment choice and outcomes. Though we did not we cannot perform a randomized controlled trial, we used propensity score matching, and we excluded heterogeneous procedure like interspecies resection and epiresection and prostate cancer. Meanwhile, the number of patients having risk factors are small, so it is difficult to do further analysis and lead to definite conclusions. In summary, robot surgery for mid-or rectal cancer showed similar long-term oncology outcomes with laparoscopic surgery for mid-or rectal cancer. And we observed comparable local control in both groups. The only difference was found in selective patients with preoperative chemotherapy and T-cell disease. I think it is warranted to perform further study to investigate whether patients with risk factor of recurrence can be considered as an appropriate candidate of robot surgery in the future. Thank you.